How do you spot basal cell carcinoma by checking moles? Imagine your skin as a canvas that tells a story about your health. While most moles are harmless, some changes can hint at something more serious. Basal cell carcinoma often doesn't start from existing moles but appears as new skin changes. To spot it early, you need to pay close attention to your skin, especially any new or changing spots. When examining your skin, look for small bumps that are shiny or translucent. These bumps might look like tiny pearls or waxy patches and can be pink, white, or flesh-colored on lighter skin. On darker skin, they may appear brown or black. Sometimes you can see tiny blood vessels within the bump, giving it a spider vein look. Check the surface of the lesion carefully. It might be smooth and dome-shaped, or it could be a flat, scaly patch with a raised border. Some basal cell carcinomas look like a waxy scar without a clear edge. Color is another clue. Unlike regular moles, these lesions often have uneven colors, such as pink, red, brown, black, or even blue, sometimes with dark spots. Borders are important too. BCC lesions tend to have irregular, rolled, or raised edges, with a central area that may be ulcerated or lower than the surrounding skin. They are usually asymmetrical, unlike benign moles that tend to be symmetrical with smooth borders. Watch out for sores that do not heal. If a sore bleeds, oozes, crusts over repeatedly, or refuses to heal over weeks or months, it could be a sign of basal cell carcinoma. Also, pay attention to any lesion that grows slowly but steadily or changes in size, shape, color, or texture over time. These changes should prompt a visit to a healthcare professional. BCC most often appears on sun-exposed areas like the face, ears, neck, shoulders, and arms, but it can sometimes develop in less exposed regions. When checking your skin, do a thorough self-examination once a month. Focus on new spots or any changes in existing moles. Look for bumps that seem shiny or waxy, and note any sores that bleed or don't heal. If you notice anything suspicious, it's crucial to see a dermatologist promptly. They will examine your skin visually and may perform a biopsy, where a small tissue sample is taken and examined under a microscope to confirm if cancer cells are present. Early detection is key because untreated basal cell carcinoma can grow and invade deeper layers of the skin, muscles, or even bone. While it rarely spreads to other parts of the body, it can cause significant local damage if not treated. Remember, basal cell carcinoma is not just a changing mole but often presents as a new, shiny bump, a non-healing sore, or a scaly patch with irregular borders. Regular skin checks and professional evaluations are essential for maintaining healthy skin and catching any issues early. If you see any of these signs, don't hesitate to consult a healthcare provider for personalized advice and treatment options.